Good afternoon. This is Kyle Dahl, the administrator of Whitney Oaks Care Center, giving you a brief update on the happenings here at Whitney Oaks. On the onset, we want to thank all of those who have helped in the success of caring for our residents here, including the many licensed nurses, CNAs, housekeepers, dietary staff, essential roles in making sure that our residents here are cared for. We can assure you that the residents are being well cared for under the challenging circumstances that we all face. We have put many different processes in place to ensure the safety of each of the residents, which is our number one priority. First of all, we have restricted visitation per Medicare guidelines and mandate that was sent out by Health and Human Services last week. That means only essential personnel are allowed inside of the facility, and even those personnel have to be screened for temperature and cough and other flu-like symptoms. Each of our residents every day are given a checkup, including a temperature check, that's documented in their personal medical record. We meet weekly, if not more often, with our medical director and discuss the different infection control procedures that we want to put in place and continue to put in place based on best practices that we're hearing from the federal, state, and local government. One of the biggest challenges that we face is making sure that we have enough of what is referred to as PPE, or personal protective equipment. That includes things like N95 masks, isolation gowns, and regular procedural masks. If you know someone who have extra of those items around, we would be kindly accept those items from you, as there is a critical shortage and the supply chains have dried up, and we're continuing to work to procure those additional items. At this time, we are not having any communal dining in the facility or communal activities to make sure that we're keeping the residents separated as much as possible. The physicians have initiated a telehealth program through an application called Zoom. And what that does is it allows us to do all of the vital sign check and the information that's needed. And then the doctor is able to come on using an iPad and being able to see your family member without having to come in contact or spread potential infection. We recently have just acquired an additional iPad that will be used in the activities department, where through scheduling with them, you will be able to connect with the Zoom app to be able to have a brief conversation with your family member here in the facility, which we're excited about, so that you can see them face to face. In addition, if you have other technologies, we do have Wi-Fi here, and if somebody has a phone, things like FaceTime or Google Hangouts or other programs similar to that would work just as well. Other things that we have put in place to try to help protect our residents is we are not allowing social leave of absences. And what that would mean is somebody desiring to leave the facility to go out to an activity, go out to lunch, go out to an event. The reason for that is, again, for safety, not having that person be exposed to things, but also in turn, not having them bring anything back into the facility. Things such as haircuts are being postponed, non-medically necessary doctor's appointments or other appointments are being postponed. Clearly, if medically indicated, we still are working with our providers to be able to send people out. We're not doing testing for COVID-19 here at the facility. We are monitoring signs and symptoms of illness, and if anyone were to start showing signs and symptoms of the flu or COVID, including a fever with cough, then we would send them out to have them evaluated at a local emergency room who would be more prepared to take care of them and not put other residents at risk. If we do have any residents that have some type of an infection that's not COVID-19, we use isolation procedures. And in those procedures, we will wear proper protective equipment. as necessary. We have a full housekeeping staff. They're here every day as well. We're increasing the numbers of things that we're cleaning on a regular daily basis, including high-touch areas like handrails or doorknobs or bathrooms. We have a machine that allows us to do a sanitizing and disinfecting of a room. And we have ordered a new machine by Clorox that will allow us to be able to actually spray on different chemicals that will have a kill time of 2 minutes to help us, again, decrease infections. And we'll be using those in rooms like our main dining rooms, rehab gyms, public restrooms that are high-use areas as well. At this time, we are not sending food out of the building for patients that might go to dialysis at the request of the dialysis centers. In addition, we do accept deliveries such as care packages marked with the resident's name. So if they have their favorite drink, like Ensure, or if they need cigarettes, or they have some preferential item that they would like, you can simply bring it to the front, knock on the door, and let them know. And we ask that you would please label it with the resident's name, and we'll make sure that we get that to them. As far as delivery of food that's coming into the facility, at this time we are only taking food deliveries from commercial vendors such as restaurants or fast food restaurants, and then that would also be given to the front desk and they would deliver that to the patient in your behalf. We are not allowing items that might have come from home, as there is still debate on how long any potential virus or exposure of the virus would last on any particular surface. We're still practicing social distancing in the facility, so we're trying to keep our meetings where people are separated, or limiting the number of meetings that we have. We're not doing things like shaking hands and the normal things that we would often do customarily, just to try to prevent that additional exposure. We have all of our staff are tested each day as they come to work, and if staff are feeling ill or have a fever, they are asked to stay home, and they cannot come back to work until they've been cleared of any fever without any fever reduction medication for at least 48 hours. We're asking staff as well to have a preparation bag if there's some reason that we need additional staff to stay, where they could change clothes and things of that nature. And if they're coming from other facilities, we also are mandating that they change their uniform. We've instructed the staff as they go home to take their shoes off at their front door, to wash their uniform, to take a shower, so that they wouldn't be potentially spreading any infection that they might come in contact with here. We'll try to continue to keep you updated on the latest things that are going on. And as we get more information about our Zoom access for your ability to talk with your family member or friend here at the facility, we'll be passing that information on as well. If there's any concerns that you would like us to address, feel free to reach out to us at the facility. Our essential personnel are here. We do have some of our staff members that are working from home through telework. So in some cases, you may not be able to get a hold of certain departments, and they will be checking in with their messages and working from home through email. And so some departments like payroll or accounts payable or the business office may not be here each day, and we'll try to alert you more as we get more information on that. We're trying to post on our main website any visitor changes. Many of you may have received a audio conference call that I sent out to all of our family members and responsible parties. We will try to do that as well and reach out to you in the different ways that might be help you be able to get more information about what's going on day to day and the changes in the fluid nature of what's going on. The lockdown visitation is a nationwide federal mandate, and so until that changes, we'll continue to follow that. Today we were notified from the state that in Sacramento, they have put a shelter in place for non-essential personnel in terms of the rest of workers out there. And so in some cases, that makes it challenging for us as well to be able to get a hold of other items that we need. But in terms of getting our normal deliveries for food and paper products and all of those kinds of things, we are doing that. We have a 24-hour hotline that we're able to call and work with our sister facilities for items that we might need, that another facility might have additional items for. And those items are being updated on a regular basis, usually every day or every other day, to ensure that as supplies move back and forth, that we have enough of those available as well. If you have any questions, feel free to reach out to the facility. Our main point of contact for just general questions would be our social services. If you're familiar with our supervisors at the desk, you're certainly welcome to give them a call. Cynthia's answering our phone on our weekdays. We have George as our ward clerk who continues to work and answer the phones, and we'll do our best we can to get back to you as quickly as possible. Thank you for taking your time to listen to this message, and we wish you a good afternoon, and God bless.